Hello. This is Abrielle Livingston. Thank you for watching Living Well with Abrielle. We are doing another public health discussion today. We are going to be reviewing care for older people, 65 and up, Medicare, and just overall well-being and how that correlates. So we have a bit of an example today that we're going to be pulling information from. The example is from an old retired couple. I'm not going to say old because that is a form of ageism. And in my youth, that I have privilege that I need to acknowledge. When I am talking about this couple, when I'm talking about this experience and the experiences that they have, because I have not experienced these things. So I do want to point that out. The couple has been retired for about 35 years. They've worked for 35 years and they've been retired for about 5 years. Their children are grown and they live in families all on their own. And they now have a fixed income, which has allowed for them to sell many of their belongings and also their previous home so that they can fit into a smaller home. So they have a condo that the two of them share. They can visit their children and their grandchildren at their leisure. However, they are faced with an increasing number of health problems, this couple, and so they really have to work together to ensure that they can take the best care of each other. In order to do that, they signed up for some community health wellness programs. The wife, the scenario, she has been participating in yoga, and Carl has been participating in Tai Chi, which is really good because they also have suffered the loss of many friends and family and neighbors who have died as they've gotten older. And so that leaves a good deal of stress on the body. So it's really good that they have an exercise routine. However, they are still faced with the anxiety that can be caused from income, housing, displacement, personal care. How will they continue to afford health care? Possibly transportation. Although this couple within the example, it does seem like they have access and ability to travel, as well as community services. What community services do they participate in? So when we are considering their needs, we have to consider 6 instrumental needs that I think not only all people, but for the most part, people who are 65 and up, their priorities, income. Most of these people are retired, and if they are still working, what is their income? What does their income look like? And how far is this income getting them? Because that'll determine housing, where they're living, how they're living. Are they able to, like this couple, sell some of their surroundings and to fit into smaller spaces? Do they share living spaces with other family members? All of those things. Do they rely on family members? Like all of those things are very important. Healthcare. Are they covered? What type of coverage do they have? What types of resources do they have available to them with the coverage that they have? Again, all of that is very important. Transportation, what's their mobility like? How do they themselves move around in their bodies? And then also, how do they get around? And that brings me to the last instrumental need, which is community services. And how are they partaking in the services that the community affords them? So it sounds like this couple, that they currently live on a fixed income, that they also downsize to also for their convenience, that they have a good amount of needs concerning income and concerning housing. It might even be beneficial to suggest that at some point in this time, over the next 20 years, I can predict that there's a chance that one of the partners might want to work, even if it is part-time, a temporary position. They don't really seem to have too many concerns regarding their mobility, as they did discuss travel. However, adjusting to the changes in their social life might be balanced by adapting to a different kind of work schedule. Although they are retired, they might be able to pick up a hobby or some kind of profession or skill that they are interested in and invested in, and that also might be able to improve the state of their mental health. They already seem to be really engaged and involved in community activities, some of the programs that they already participate in. And as a team, to be honest, they seem really rock solid when it comes to meeting extraordinary life events and coming out on the other side and being able to navigate these changes with each other. I would only predict if health problems get worse that perhaps maybe if one of them passes, then that may disrupt the plans that the other one has regarding their well-being, because they seem to have a good base as a couple. They seem to really do well taking care of each other. Their personal care really, and their health care really depends on how well this couple is taking care of each other, which is really important. I think when you are considering the population of those 65 and up, those baby boomers, the way that they have coupled and partnered to ensure like stability for their families, but also for the partnership as a team is very, very important. If there was anything to do, and if there was anything that they could do to better plan for retirement, I think, again, like, this is where I have to check and acknowledge my privilege, because I am not a working person that is working towards retirement. And I think that, like, the way that I learn in a lot of ways is by communicating with people and talking to people. And so I asked a couple of people who are 65 and up, while they were working, is there anything that they could have done to better prepare for retirement? And in most cases, a lot of these people said no. Some people said maybe a little bit more financial planning. Some people said, yes, maybe prioritizing their health a little bit more. But from the example that we have about this couple, I think that possibly planning for their mental well-being might have been something that they could have done to plan for better for retirement. But upon speaking to a couple of people, I started to notice a trend that retirement is a concept that is born out of working. And so if you are used to going into work for a corporation, for a company or what have you, then you have it in your mind that at some point you're going to retire from this company and you are going to have a retirement plan. And so those are the systems that have been set up, and those are the systems that have been set up for boomers and even those to follow boomers. But right now we have boomers because they're the retirement age. This is what has been laid out for them. This is the path that has been, designated for them. So as far as what they could have done, it sounds like they've done a pretty good job. They've been able to relinquish some of their assets. They have been able to still manage their relationship with family well. They've been still able to travel, and they've still been able to prioritize their health and their needs for health. The fact that they're thinking about these things suggests that there is, a great deal of thought and forethought going into their planning for the next 20 years, which is good, because some people, they may not have the ability or the time or the mindset to be able to plan about 20 years ahead, deeper into retirement. And so it sounds like Carl and Sarah are doing the best that they can to strategically plan. If I had to give them two pieces of healthcare advice, I would definitely suggest that they look into mental health therapy. I would suggest that they both get their own therapist. Carl needs a therapist and Sarah needs a therapist, because they are two separate people, two separate entities that have been operating as a unit for, the past couple of years. And I would also suggest that they get couples therapy to help them also continue to navigate and traverse this life together. Oops. Excuse me. I'm so sorry. That they can continue to work together to build connections, to establish more of their purpose. And it's so interesting, because I have been thinking about the establishment, like the direction that we as humans push ourselves to have a purpose and to have meaning versus just taking care of ourselves. The purpose is to take care of ourselves. And so I definitely suggest that for their health and well-being, that they look into therapy. And an additional piece, I would also suggest that they look into maybe some accounting guidance that might help them navigate some of the Medicare plans, even some of the anxiety that they have around finances. It may help them kind of like navigate some of those things. But again, that might be a component of therapy. If they have a really good therapist, they may be able to talk. They may be able to talk to their therapist about their finances it doesn't seem like there was no mention of them utilizing primary care. And so I would suggest that maybe they utilize their primary care. But I when I spoke to a couple of older populated people, they have said that they don't even really use their Medicaid plans. They mostly take care of themselves. They partake in some of the community services in the wellness plans that are available, and they tend to stay away from hospitals and doctors. I mean, I'm sure for a number of reasons. I didn't get any specific one outside of ageism, ableism, in some cases oppression, racism, but just also a general feeling of not really being heard, and not really being treated for some of the things that they need to be treated for, as opposed to just being charged a bill for existing, which is also a very real kind of sentiment. So yes, 2 pieces of advice that I would give Sarah and Carl is that they definitely prioritize their mental health, and that they begin to see primary care physicians just to kind of get there, just to check on their bodies, just to make sure that their bodies are good, so that when they are utilizing their community wellness programs, they are utilizing it to the best of their ability. They can also form relationships with the teachers and the practitioners that are available to them there, and share consistent and clear information that they know about themselves. This discussion in particular definitely sparked a lot of ideas surrounding coupling and relationships, and as well as how to prioritize your well-being. A lot of people, again, are setting themselves up to work, but they're not setting themselves up to be well, to continue to work. And they're also not thinking people are thinking about retirement, but they're thinking about retirement in a very financial way. They're not thinking about retirement in a way that is like, how will you actually, I'm so sorry, how they actually take care of their well-being. And so I really appreciated the dynamics that were presented in this discussion, as they definitely gave some insight. And although, again, I have said, like, I am not a person that is in this bracket, it gives me some insight to think about some of their needs, and even asking them questions about their healthcare and how they feel about their healthcare, and also how they feel about their health and their bodies. It really changed the dynamics surrounding that. So I'm really gratefully appreciative for all of those who checked out this video. I hope that this information is sustainable and can qualify it as a response. And I'm very grateful to all of those who check this video out. If you really like this information that I'm sharing, and you want to join in the discussion, please like and subscribe. And I will see you next time on the next Living Well with Ebrielle discussion, public health discussion. Thank you. Peace.